Hello everyone. This presentation is on Shen Ling by Shen, also called ginseng, poria, and white atractylodes powder. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Shen Ling by Shen is classified under tonify. A representative pattern is spleen chi deficiency with dampness causing poor appetite, loose stools, fatigue and weight loss. Important ingredients include Ren Shen, Bai Zhu, Fu Ling, Shan Yao, Bai Bian Du, Lion Zai, Yi Ren, Sha Ren, Jai Zheng, Gan Kao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 50-year-old woman with chronic loose stools, fatigue, hypertension and type 2 diabetes. The current medicines are metformin, hydrochlorothiazide, warfarin. This case gives a plausible reason to consider Shen Ling by Shen, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Gan Kao plus hydrochlorothiazide. The mechanism is licorice may worsen potassium loss and raise blood pressure. The clinical significance is moderate with longer use. My management plan is monitor blood pressure and potassium. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Ren Shen plus metformin. The mechanism is ginseng can lower blood glucose, producing an additive effect. The clinical significance is moderate in diabetes. My management plan is increase glucose monitoring when treatment begins. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Ren Shen plus warfarin. The mechanism is ginseng has variable evidence for altering warfarin anticoagulation. The clinical significance is potentially moderate because INR changes can be consequential. My management plan is monitor INR when starting or stopping the formula. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Shen Ling by Shen may be reasonable when the patient's presentation matches spleen chi deficiency with dampness causing poor appetite, loose stools, fatigue and weight loss. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.